Good afternoon, everyone. Thank you for joining us this afternoon for our Facebook Live. I am Beth Panchal. I'm a family physician with Ohio State Wexner Medical Center, and I'm happy to talk with everyone out there about staying healthy while staying at home. Now, I am like many of you, I am home with my three boys that are very active. And so part of what we struggle with is how do we keep ourselves healthy, right? How do we continue on with staying strong through all of this while we are staying at home? And of course, having our kids home with us is a bit of a struggle too. So here are some things that, me and my family have really started to do. And we're going to touch base with a couple of just some simple things, and then we'll take some questions at the end. So first of all, we got to follow hygiene advice. Okay. We have been hearing it over and over again. Wash your hands, don't touch your face, keep the distance 6 feet away. This is really hard to do with children, of course. Now, kids in your own home, you're living with them. This does not apply, the keeping your distance. But it does apply to their friends. There's nothing saying that we can't go outside and exercise and take a walk, but we really need to be cognizant of those around us. And you may run into some friends of your children, and really having a good discussion with your kids about keeping their distance from their friends. It's hard to do. Now let's talk about washing our hands and how frequently do we need to do it? Well, you need to wash your hands before you eat, after using the restroom. If you're bringing in groceries, you want to make sure you're washing your hands after that. Use soap. Soap is great. The virus we know is being destroyed by just simple hand soap. It can be regular soap or antibacterial soap. If you want to use hand sanitizer, use at least 60% alcohol in the hand sanitizer. We do recommend, though, that if there's any visible dirt, soil, anything like that on your hands, that you need to do a good hand washing for at least 20 seconds. Now, as you can see, I am now wearing my wedding rings around my neck instead of on my hands. The reason for this is there is some evidence that germs can kind of stick around in the rings themselves. And so during this time period when we're really trying to keep healthy, and if we do get exposed to the COVID virus or other viruses or bacteria for that matter, this is a good way to making sure that you're really doing a good job with hand washing. Next, get some physical exercise. Okay, this means get outside if you can. The weather is gorgeous today, so this is a great time to go for a walk, go for a run, go with your family. If you have family with you, if not, go by yourself. But get outside. Okay, get some exercise. If you can't get outside, or physical exercise is not something you're necessarily able to do. There's other things that you can do at home, just moving around, not sitting in one place for too long. There are some great online free resources for doing exercise with your kids. Some good yoga videos, yoga apps that you can do with kids. My husband and I did some yoga with my kids the other night from a kids yoga video, and we had a lot of fun with it. So just laugh, and that's all part of staying physically healthy as well. And then of course mentally healthy. Exercise is a big part of mental health, but we know that being cut off from our friends and our family can really wear on us mentally. So if you reach out, we have so many capabilities now with FaceTime and video chats, just talking on the phone, sending a quick text message to really reach out to your friends and family that you may not have heard from in a while, check in on them. Us primary care physicians, we are still available, and your primary care providers, reach out to us. A lot of us are moving toward video and phone visits. And so we are still available. We're still here for you. And there are some great psychology physicians and providers out there, mental health providers that are also doing phone and video counseling. So there are definitely resources out there. Your primary care provider can help you with those resources. And then last but not least, eating healthy. Being stuck inside, what do we want to do? I don't know about you, but I love snacking. I love cookies, but we really need to try to stay moderation. Moderation is the key. So not just having the bad snacks available, but keeping healthy snacks available, carrots, celery, the little healthy snacks that can really replace the heavy things like the cookies. And if you do need a cookie, have one, have two, don't have 10. So these are just very, very simple things that we can do to stay healthy. Now, you may be asking about supplements or things like that. We don't really have good resources right now or good studies that say what supplements or if there are supplements that might help with prevention of COVID or even treatment for COVID. So any kind of supplements, things like that, you should really talk with your primary care provider about that before starting anything over the counter. All right, great. Now, I would love to take some questions. So I'm just going to scroll through the feed here and see if there's any questions. How do you practice social distancing if you have to escort someone in wheelchair? Any PPE besides a mask? That's a great question. So if you are escorting someone in a wheelchair, you obviously social distance thing does not apply to that. But if there is concern that person or you yourself are sick, even if it's it can be, we still get flu, right? We're still getting colds on top of the COVID. So if you or the person you're escorting is sick at all, yes, a simple surgical face mask is good. It is fine to wear. Other PPE than that right now out in the community, we're not really seeing that we need to recommend at this point. But if you are working with someone who has tested positive, obviously, and you're not able to avoid them, there are other things, getting a shield, goggles, gloves. There's other things that really need to be done, and talking with your health provider as well as that person's health provider about the things that you should and shouldn't be doing is very important. Someone saying they had a negative test, they felt guilty for taking it. Don't feel guilty. We are telling everyone if you have these symptoms, give the OSU hotline a call and to get through that screening process to see if you need to be tested. If they said you need tested, then go get tested. If you come back negative, that's great. That's great. Okay. And so recommendations for wearing masks changing. They're changing every day. And I wish I could tell you what it's going to be like tomorrow. I know here at OSU that we are implementing more face masks. So anytime any of us are in direct contact or even near anyone else, including patients or other providers, we are wearing face masks. Should we wash our fruits and vegetables? What should you wash them in? You can simply rinse them off under the tap water and just do a good job of kind of rubbing them or scrubbing them with a scrub brush. There's really no need for using hand soap or any other sanitizer on those fruits and vegetables at this time. And let's keep going here. Okay. So there is some asking about visitors when it comes to patients in the hospital or even patients coming into our outpatient care settings. And unfortunately, some people are not being allowed to witness ultrasounds of their babies. And that is an unfortunate side effect of this pandemic right now. So unfortunately, I don't have any information if that's going to be changing anytime soon. I can say that it's likely that's going to be in place for quite some time yet. And we have capabilities of recording things like that. And of course, taking pictures. And so using those modalities, FaceTiming while you're getting the ultrasound, while your spouse is getting the ultrasound, or your partner is getting the ultrasound is really a good way to kind of go through this. Okay. And I'm getting some other just asking about disinfectants and sanitizers, regular bleach. So, the disinfectant surfaces, a good website to go off of is the CDC website. They have a great resource on there about what kind of disinfectants are really good to use. We are looking for those FDA approval ones that we think are actually going to kill this virus. So. Running and walking outside wearing a face mask. No, at this point in time, if you're healthy and you have no symptoms and you want to go for a run or for a walk outside, as long as you're practicing social distancing, of course, there's really no need at this point in time to wear a mask. Now, is that going to change next week? Possibly. Unfortunately, we just don't know yet. But as of today, you go out for a walk, go out for a run. I'm out there. I'm not wearing a face mask at this point because I am healthy and my whole family's healthy, and hopefully we will stay healthy. And I'm getting a lot of go Bucks. Thank you so much for everyone. If there's any other questions, we will definitely answer them as they come in. If I did not get to a question that you had, I apologize, but we'll try to get to it sometime later. And of course, always reaching out to your primary health provider will be a great way to know what's best for you individually as well. Thank you, and I hope everyone has a great weekend. Get out there and get some exercise.